Dr. Zorba-Paster is here to take your calls.
And remember, that number to call is 608-270-9933. Welcome back.
Good to be here.
We had a story in the news how important it is for people over 64 to get their booster shots.
Right, exactly. And the booster shots are really critical. The first booster shot is really important, and that, I believe, is 6 months after the full immunizations. You always have to go to the CDC website because that changes quite often. And then the second booster shot comes after that 4 or 5 months. And the reality is we might be getting boosters every year. We'll know a little bit more when fall comes.
So, and I read a story about, the deaths with COVID are predicted to be at a certain number, but the key is the hospitalizations are expected to
I think we're living with COVID. COVID is going to be here. We live with influenza. We have between 30,000 and 70,000 deaths every year from influenza. That's an important issue. RSV, respiratory syncytial virus, affects children at a young age, but 15,000 adults a year die of RSV. We don't announce how many die of RSV. I think the time has come for us not to do as much announcing about COVID unless the hospitalizations go up and we have to take action.
All right, let's go to the phones. We've got a lot of people waiting to talk. We'll start with Denise from Beloit. Hi, Denise. What's your question?
I'm just wondering, I had my first shingles shot about a month ago. I've heard you need to get 2. If so, when do I need to get that one?
Sure. You've got to get the shingle shot that we have right now. The GSK shingle shot is much better than the Merck shot. The Merck shot was about 60% effective, and the GSK shot is about 95%. I can't remember if it's 4 months, 5 months, or 6 months. Go to the website, cdc.gov. You can look at it, but it's important to get that shingle shot. Shingles is awful, and these immunizations for shingles really work. And it brings up another important point. Many people have not gotten immunized for other things when they have to because of COVID. They haven't gone into their doctor's office. Getting immunized, doing all the preventive things you're supposed to do, such as mammograms, colonoscopy, the time is to step up for your health.
And our next caller, hey, Barb from Portage, what's your question?
Yeah, I've got all my shots and stuff, and I still would like to know where I can get to find out if I've got everything.
Well, one thing you can do is you can go to the website. If you look, for instance, at Epic, which are what most of us are on in terms of this year, you can go back to basically to your doctor's website and see if you need any more immunizations, because it's right in the website, right on my chart in Epic, and pretty much everyone in our area is on Epic.
But what if you don't have that option?
Then you call your doctor and ask.
Very simple. Let's go to Cynthia now in Jefferson. Hi, Cynthia. What's your question?
Hi, I'm about 18 days out from the signs of my first symptoms of having COVID. And when I tested myself 4 days ago, I was still positive with a home kit. And I have a friend that's immunocompromised, and I was wondering if I need to be worried about going near her now.
Oh, sure. Well, you may be positive for quite some time. So right now, according to the CDC, day 0 is the first day you had symptoms. That's day 0. And then you count 1, 2, 3, 4, 5 days from that. And then you don't have to go without a mask. You have to wear a mask for those 5 days, unless you still have symptoms. So for you, according to the CDC, you are not actually going to spread COVID. On the other hand, you're with somebody who's immunocompromised. Who knows if you're going to get it again or something else? Wear your mask.
Absolutely.
That's what I would do.
All right.
Safe.
Hi, Julie from Oregon. What is your question?
Yeah, on the 31st, I had my second booster shot, and ever since then, off and on during the day, I'll break out in sweats, and I was just wondering if that could be from the booster shot.
Probably not, but the important thing that's really important
10 days
is
ago.
if you've got anything going on, you've got to talk to your doctor, because you might have something else that's going on besides actually getting the COVID immunizations. You don't want to put everything onto that.
All right, we have time for Sue in McFarland. Hi, Sue.
Hi.
What's your question?
I was wondering how soon after COVID that I can get my second booster.
You can get your second booster as soon as you feel good enough to get that second booster. There's no time that you have to wait before you get that booster if you've had
When
COVID.
symptoms are gone.
Symptoms are gone and you feel good.
Okay, well, thank you.
All right, thanks for calling. We have time for one more?
All right. Hey, Chris from Lodi. What's your question?
I had a steroid shot in my shoulder Tuesday, and I still have to get my second booster, and I'm just wondering if it's okay to get it or if I need to wait.
on the whole, the recommendation is get your booster, even though you had the steroid shot, because the booster, even though the steroid may interfere completely with your immunity, it's better than not getting the booster at all. So the answer is get your booster as soon as you can.
And use the other arm.
And use the other arm.
Sort of balance it out. All right, Zorba, thank you. Thank you all for
Pleasure
calling.
to be here.
We'll see you next time.